Hello, this is Dr. Stanley Lang. Welcome to this broadcast, which is on the topic of when medicines cause insulin resistance. And so there's a lot of different medicines that cause insulin resistance or aggravate it. But before we get into those medicines, I want to tell you a little bit about a patient that I saw today, who I saw for the first time 6 weeks ago. And I introduced him to my usual low glycemic eating plan because he was significantly overweight and desirous of losing weight and treating his high blood pressure without medication. Now, he had sort of an aggravating problem, which is that he was on a couple of medications that are psychiatric medicines that are well known to cause or worsen insulin resistance. In spite of this, he was able to lose 17 pounds in 6 weeks, and that's not uncommon. But he also started to experience more of a sort of a wall against losing more weight. In other words, he noticed it slowing down. And this is very common when people are on medications that actually aggravate or cause insulin resistance. So what are the medicines that can do that? Well, there's a lot of them. And this is a partial list, but statins are at the top, of course. One of the most popular drugs. It's not well appreciated how significant the risk is for developing diabetes if you take a statin drug. Current estimates are about 1 in 50 will become diabetic, which means that a lot higher percentage of that are in insulin resistance, which makes a person stay fat. The second thing here is water pills, which the one that causes or the class that causes this insulin resistance is called the thiazides. So that's one of the most common water pills given. And then the third one are beta blockers. This is a common heart drug, and this group of drugs can cause insulin resistance. And then the next group of drugs are the steroids, and these are often given for a variety of different inflammatory conditions, asthma, things like that. And then finally, I have psych meds at the bottom, and this is a much more complicated list because there is a group of drugs which we call the atypical antipsychotics, which are basically strong tranquilizers. So they're used more often for conditions that have nothing to do with psychosis. They're used a lot in bipolar disorder. They're used a lot for treatment of depression. They're added on to antidepressants. So they're used a lot, and they profoundly cause insulin resistance. Almost everybody that I see that is on one of these medicines has difficulty with gaining weight, and they just can't stop the weight gain even when they're eating cautiously. So the patient that I was seeing back was on one of these drugs, and so we talked about how the drug was slowing him down in terms of reversing his insulin resistance, but that it wasn't impossible to overcome that effect. It's a big effect where the drug pushes the body into insulin resistance, which means it's pushing it into fat storage chemistry. And other drugs that can do that in the psych medicine category are all of the antidepressants. Now, it's too complicated of a story to talk about here because some of them seem to actually improve insulin resistance, but most of them have been implicated in worsening insulin resistance, which is associated with weight gain. And so you have somebody that's already depressed, and now you're making them overweight because of the medicine that they're taking, because they're eating similar to how they were, and now all of a sudden you push them into more insulin resistance, and that triggers them to store fat even if they weren't overweight before. So what can you do if you are taking one of these medicines? Well, the solution is the strategy that I shared with this patient at the very beginning of this video, which is the low glycemic eating plan. There is no other solution. Now, there are a variety of different low glycemic eating plans, but it has to be low glycemic or it won't work. You will not reverse this effect if it's developing in you. If you see weight slowly creeping up, you've got to be radically on board with the low glycemic eating plan, which is either something like the eating plan that is in the free book that I have offered underneath or on this video, or the ketogenic diet, which is even more low glycemic of an eating plan. So either way, you will benefit by immediately going to low glycemic eating if you're on one of these medicines and you can't get off of it for whatever reason, your doctor feels like it's critical for your health. The strongest medicines that do these are those atypical psychotics, the major, what we used to call major tranquilizers, the major anxiety medicines that are used a lot, as I said, for bipolar, for depression, for a lot of things that got nothing to do with psychosis. If you're stuck with that, or if you're gaining weight and you're on some medicine, there's a good chance the medicine could be contributing to the whole problem. The solution, though, is to be even more committed to the low glycemic eating plan, or else you're not going to be able to reverse what's happening. It's just going to get worse. And it doesn't have to go that way if you're aware of what's happening and why it's happening. So I hope you found this information helpful. Please pick up the free book by clicking on the link below this video or on the video. I wish you well. God bless and have a great day.